health care. Let me get a minute or two here to kind of set the table. I've been involved in these issues since I was in the state legislature. I care deeply about the situation that existed in Oregon when people with pre-existing conditions, like the clerk at a local convenience store in Hood River talked to me about, who was also diabetic, who could not get access to health insurance. I was a young legislator in Salem, and that really bothered me because these diseases, these afflictions, whatever it is, they don't pick you by party. It just happens. And you ought to have the right to get coverage. So I actually fought hard in Salem to help grow and create or expand our high-risk pools so that people had a place to go to get coverage. You're shaking your head no?
Well, you know, I've had family members who had to get insurance in the past before the ACA in high-risk pools. And one of the things that we often hear out of Washington is we want you to keep your own doctor. That's not a reality in a high-risk pool. You can't even choose your own insurer.
Let me continue on there because I'll actually go past high-risk pools. I think it can be a reality, and my point was at that time there was no federal discussion around pre-existing condition ban. So our option at the state level was to try and find help. And so we did. We expanded the high-risk pools. We created an insurance product so people had somewhere to go other than the bankruptcy court. We announced legislation that I'm the lead sponsor on to make sure that people with pre-existing situations, conditions, will continue to have coverage as they have today. They will continue to not be discriminated against because of pre-existing conditions. So that's number one. I think you'd find we're in agreement on pre-existing condition.
Would we be able to choose our own insurer? In a high-risk pool, do we get to choose our insurance company?
Now, I didn't say that's limited to the high-risk pool, okay? So this is throughout insurance policy. If you got a pre-existing condition, you should have the right to have access to affordable health insurance, period. And so that's part of it. So then there was an issue about the caps, right? The lifetime caps. I can tell you from personal experience, that's something that needed to be changed and done away with, and we will not return to the days where there's a lifetime cap, period. All right? So whatever you're reading, whatever they're telling you, at least from this one member of Congress who happens to chair a pretty important committee, we're not going back to the days of pre-existing condition and back to the days of lifetime caps, period. And I supported putting your kids on your insurance before the ACA was ever a law. I supported getting rid of the pre-existing condition limitations before ACA was ever a law. I tried to do things about it in Oregon. I helped implement the Oregon Health Plan in 1991. When I was majority leader, I created a select committee in Salem, and it was bipartisan. And we implemented what is now known as the Oregon Health Plan, OHP. And we did it. And we got a waiver from the federal government to do it. I fought hard to make sure we had state funding for a program that allows seniors to get care in their homes. That required a waiver from Medicaid. We want to protect and guarantee access to insurance for people who have issues. And so I'm just telling you, I don't know anybody back here wants, well, there may be somebody, there's people all over the map on issues, but I'm not one of them. And I want to make sure that people continue to have access to care. I'm looking through my notes here. So the caps, we're not going back to those days. Pre-existing condition, I'm fully on board to make sure people with pre-existing health issues continue to get access to care or to insurance. There was a question about prescriptions. My wife used to buy one of those EpiPens because she has some level of reaction to these things. Her doctor suggested she get an EpiPen, which she did, and they were, I don't know, $50, $75, whatever, and they wore out, they have a life on them. And then somebody cornered that market, Mylan, and they jacked up the price to several hundreds of dollars. Her doctor said, well, if you carry a couple Benadryl, that you don't go into anaphylactic shock, so you're probably okay, and she quit. There are a lot of people who don't have that option. And so I'm working with Kurt Schrader, Democrat from the 5th District, and Gus Bilirakis, a Republican from Florida. We're going to move legislation they've come up with that says in situations like that, and what's that antibiotic drug, Daraprim, where that market got cornered too, Doctor, you're probably familiar with that. where you can basically jump the line at FDA to get a generic into the market. All right, so that there's an alternative. This will make a big difference, by the way, because the only way they can corner a market, jack up the prices if there's no alternative. As the new administration starts, there's basically 3,000 applications for generic alternative backlog, and it takes an average of 40 months. So one of the things that our committee is going to do is major oversight on FDA. We will have a hearing at the end of this month on what's called GDUFA, which is the generic funding system for FDA. At the end of last year, with bipartisan work, President Obama signed into law 21st Century Cures. This law is designed to get at the mental health issues. This law is designed to get at getting new drugs into the market sooner, and a whole bunch more. And this is where we put $500 million in for opioid abuse. I did a round table right around that table you're at today with families who are suffering from their kids, their relatives from opioid abuse, and their law enforcement and others. We do the same thing on mental health. That's all in law. We'll do the oversight and implementation at the Energy and Commerce Committee to tackle these problems. So those are some of the issues. I supported the state's waiver, which was just granted by the Obama administration for the Oregon Health Plan. I'm actually looking at what we've done in Oregon with CCOs, thinking that's not a bad model. I've met with multiple governors from around the country who do even more with health risk assessments, where they can get around a person with multiple conditions and say, if we can work closely with this person, we can not only improve their healthcare outcomes, we can lower costs, but we have to go to the government to get a waiver to do it, and it takes forever and costs a fortune. We had one governor, the governor of Utah, said, I want to be able to communicate with my Medicaid folks by email, among other ways. He had to apply for a Section 1115 waiver. It took 3 months and was turned down by CMS by email, by the way. So, I mean, there's just, I want more flexibility back to the states when it comes to Medicaid, because I think the states are telling us, they're pleading for us. I have letters from our own state asking for many of the changes you'll see our committee move forward on to give more flexibility to the states, both on the Medicaid side, and then let me talk about the private insurance pool. And I think it's Terry, right? You're a small employer. You said 25 people, mm-hmm. and you've got employees on the OHP. Mm-hmm. My wife and I were small business owners in Hood River. We bought insurance. We paid 100% of the premium for the 21 years we were in business for our employees. It's expensive, I know, but we thought that was an important commitment for the people that work for us, that we pay for their insurance, and we did it. And it was not cheap. But the individual market is collapsing. We could walk away from all of this today, and you would find I've got some charts I think they can pass out. I won't spend a lot of time, but clearly the premiums are going up 25%, I think in Oregon 27%. Just to put it in perspective, last year, there were 225 counties in America that had just one choice for patients to make on insurance. Do you know where it is this year? It's 1,022 counties. That's 1 out of every 3 counties are down to 1. There's 5 states that have just one insurer left. And if you look at their earnings calls and what they tell their investors, they're not sure they're hanging around for next year, period, regardless of what we do here. So we're trying to figure out some things that we can change here that will allow the individual market to sustain, so that some of the folks you've talked about can actually still get an individual policy if that's the market they're in. So this is hard and complicated. You're not going to see one 2,000-page bill. So that's why you'll see when I talk about it's about repairing and brick by brick, and we're fixing things as we go. And we're dealing with the additions to Medicaid, and we're dealing with the individual market. Medicaid will continue. So many of the people you're describing there, they'll continue to get care. And by the way, Oregon has a waiver that extends out, I think, another 5 years. So for your patients that are concerned about Oregon's situation, they're in good hands. They're going to continue. Oregon can continue to innovate. But we're also going to look at the input from Oregon on what they'd like to see us change going forward. So I appreciate your letting me make those comments, and let's have a discussion for the remaining time.
So I have a question about the Medicare payments you just mentioned. So are you saying that Medicaid, sorry, will we not see a reduction in money coming to Oregon?
You know, those decisions will be made going forward. Nothing's been decided at this point when it comes to the overall spending. Now, that's pretty much what happens every year in Congress. Decisions get made on how much is spent. But there will be reforms on Medicaid. But nothing's been decided yet.
So I have the number of 95% of Oregonians have insurance now, and before the ACA, 17% of Oregonians didn't have insurance. So let's look a year and a half down the line. Can you tell us here in District 2 that 95% or more Oregonians will still have the coverage they have today or better?
I would hope they would have more choices than they have today and that they would be more affordable. You know, when I met with a couple right around this table from Redmond. They told me that their premium was $1,600 a month and their deductible was $7,100. They happen to be small business owners. They were out in the pool, and they don't get any subsidy or support. They weren't asking for it, but they said that the cost was getting to the point where they weren't sure it was worth it. And I hear that from others around our district, because like you have letters and all, I've got a lot, trust me, and I want it, because I want to know what's really happening out there. And so there are people all over our district. I've got, for example, this person in Bend, 61 employees. He said the most affordable plan available comes in 150% increase in out-of-pocket costs for the year. So these are people like your workers that this person may cover, but the out-of-pocket's up 150%. So when premiums are going up 27% on average in the individual market in Oregon, that's not sustainable for people. And if the out-of-pocket costs are going up, that's not sustainable. I had an elderly couple, in Southern Oregon, a wife and her mother struggling with health insurance bill for herself, her husband, her daughter. She said with annual premiums reaching over $10,000, including $7,000 in deductibles, they have to decide whether they're going to pay for that or pay for something else. So we still have a problem out there. And so I hope we can work together to solve it.
And I hope you will be an advocate for us with the healthcare insurance industry, because the problem is it's not the Affordable Care Act, it's also the healthcare industry, healthcare insurance industry. So we're counting on you to lobby for us on our behalf and to get us the best possible healthcare insurance options at affordable. And of course, affordable is I'm fortunate that I can pay my premium, but my children when they got out of college, need a little extra help. So the subsidies were helpful to them as they got their footing, as is staying on your parents' insurance.
So are you in the individual market then?
I am in the individual market, yes. I have bought on the market. Because I don't get a subsidy, I'm on the individual market. And honestly, I'm not paying any more for insurance today than I was 5 or more years ago when I was buying insurance before the ACA. So I'm not experiencing some of these.
What plan are you on?
I just signed up with Regents. Yeah, and I moved from Wyoming. They're Blue Cross Blue Shield. I moved here from Wyoming about 5 or 6 years ago. So Wyoming is one of those states.
Wyoming versus what you're paying here.
Right.
Okay.
So I have seen costs go up, but I'm at probably about the same point as before.
What's happening with your deductibles?
My deductible, I usually choose the bronze plan, so the deductible has only gone up a little bit. So I'm not, seeing this huge, but I'm fortunate. But I'm here really to speak about other people who aren't so fortunate that need. And I also want to encourage, to make it affordable for young people. As a mom, I feel so much better knowing that my kids can have insurance.
And you raised a really important point that I'd like to address, because it's something we are looking at. One of the things, because affordability for young people is crucial for a couple of things. One, so that they can afford a policy, correct?
Right.
I mean, the premium. And the second thing is, my wife and I have a 26, soon to be 27-year-old son, and I sort of know the attitude that, if you're young enough, you're never going to get sick, you're never going to, so why should you have insurance anyway? Why am I being forced to do it? He had a better attitude about it, but, here's what happened, though. the studies show that on average, an older person, say me, is about 4.8 times more expensive when it comes to healthcare. We use the system more, right? And so when you look at versus a young person, and so the band in that insurance range on average should be about 5 to 1. The Affordable Care Act compressed that band down to an artificial 3 to 1. Okay, so they said, no, actually, Mr. Walden, you old person, you're actually only 3 to 1 compared to your son, when in reality, on average, they show 4.8 to 1. So a 5 to 1 versus 3 to 1. The effect of that was it increased your kids' insurance. I'm trying to remember the percentage here. It was significant because it did a cost shift from people like me to younger people. And that's something we're looking at, because here's the double side of this that makes it even worse for the overall market. If we chase those kids out, they're the young, healthy people, and if we chase them out because they say it's cheaper to pay the penalty than buy the insurance that I'm not sure I want anyway, and whatever, then it affects the pool and drives the premiums up for those who are left. This is what's happening, one of the issues in the individual market, and the result is then what they call a death spiral starts to happen. Because the more expensive it gets, the less likely your son or daughter decides to buy it, their healthy life is out, the premium goes up. And this thing keeps ratcheting the wrong way. So one of the ways to get at that is to loosen that band a bit, to get it back to what reality really is, so that you get those young people saying, okay, I can afford it, it's better. They're back in, the pool's healthier, everybody's premium should come down. That's kind of how it can balance. We push back that way. So that's one of the things we're actively considering.
So am I hearing that we're going to keep the individual mandate?
No, because there are other ways to get at this. There's an issue called continuation of coverage. So basically, let me get, do you like well, not you, you're way too young, but Medicare Part D for seniors.
I'm praying, I'm hoping I get old faster so I can get there.
No. Yeah, it'll be like Medicare Part D. We're looking at that as a model because I actually think that works pretty well. It has about 90% senior citizen satisfaction. The drug costs were forced down because they actually have to negotiate for price there between the insurance companies, the drug manufacturers, and they're after your business. And so the cost of that program today is 40% less than what they anticipated it would be when we passed it back in, I think, 2003. And so what happened was you're not required as a senior citizen to sign up for Medicare Part D, are you? You're not. There's no requirement. But if you don't sign up when you start, when you're eligible, then if you do join later, like when you're sick and suddenly need prescriptions, you pay more. That's the way the pooling works. And so what we're trying to do is create a system that doesn't have the IRS as the enforcer, but rather has common sense, and you pay a little more if you didn't get involved. It's sort of, think of it a bit like a homeowner's policy. You can't buy it when the roof's on fire. It's a little too late, right? And so what we're trying to do is create a system that's model after a system that's worked really well for Medicare Part D, where you sign up right away, then you're in that pool, then everybody's rates are down, and when you need it, it's there, and it's more affordable for everybody. But if you wait until you're 6 and you sign up, then you're gonna have to pay a little bit more. So I know we're about at the end of the clock, because I'm getting the signal, I've got some people waiting out here, but let me stop and go back your direction.
Well, we thank you so much for your time, Congressman, and obviously healthcare is important, but it's not the only thing that we want to continue to dialogue with you about. So we are happy and grateful that you're open to continuing conversation with us. We really appreciate that.
Absolutely.
And we appreciate your time today as well.
And these stories are really helpful because we're trying to get this right. There's no advantage either from a policy standpoint or a political standpoint to make this worse than it is. So the extent you can tell me what's working and what's not, share those letters with me. It helps inform what we're trying to do.
Well, the collective at this table, Congressman, has supported of the Affordable Care Act. We actually like the way it is right now. So that's kind of what we wanted to impart to you today. that it, you know,
We did
maybe it
very
needs a
effectively.
tweak here and there, but we certainly don't want it repealed or dismantled. And that was the thrust of our being here today, and that is what we wanted to convey to you.
Thank you very
So
much.
hopefully that we broaden your perspective a little bit today.
And Dr. Lynn, thanks to your spouse for the work done out at Source. You know, there was a point where they were going to close that, and the community and I led an effort to keep it open and get it improved. But we have so much more work to do with our veterans, this is a huge issue about getting access to care in a timely manner.
Absolutely.
We're not there yet for our vets, and you can tell your spouse my resolve is only stronger. So.
She'll be delighted to hear that, and we hope to chat with you sometime in the future about that and about other range of healthcare issues.
Yeah, I went out to Source, I don't know, it was about 2 months ago, I guess, and met with them. I was around Veterans Day, I think, and had a meeting to hear. They've got a real staffing shortage there. It's causing all kinds of problems. Troy knows well. He was with me out there. This is a serious issue because when you have that shortage, and it is a workforce shortage, it's a payment shortage, but it wasn't even as much payment as it was competition against private practice that can forgive student loans and all. They have such a small budget of that, they couldn't offer up that incentive, so they were having trouble recruiting, among other things. But we're all over that one too. So thank you all very much.
Thank you so much for your time.
Thank you.
Thank you.
Bye.
Bye.
Crack a door, it's warm here.
Did everybody sign the check-in sheet?
Miss anybody? Do I need to too?
No.
Okay.
You know how to teach